Hello, my name is Jeanne Berg. I'm a pharmacist and a diabetes educator, and I stay in the town called Secunda, which is in the rural part of sunny South Africa. Today I would like to speak with you about diabetes and specifically complications of diabetes. Diabetes complications are characterized into two different types, microvascular and macrovascular. Micro refers to the small blood vessels in the body, and these blood vessels are the vessels which carry blood to the kidneys, the eyes and the nervous system of the body. Macrovascular or macro blood vessels are the larger blood vessels in the body, and they work from the heart. Arteries are the main blood vessels which carry blood from the heart to the rest of the body. Arteries usually have a smooth lining when they are healthy. However, when they have constant high blood sugar working on their linings, these linings get damaged and can even rupture. Damaged arteries can have a plaque build-up. Now, plaque is a fatty material which we know as cholesterol. This plaque can actually block an artery. It can cause an embolus or a blood clot to be formed. This embolus or clot that can be formed in the artery is the factor which causes stroke. There are two other macrovascular complications of diabetes that we should discuss. One of them is called coronary arterial disease, and this is usually as a result of atherosclerosis. Atherosclerosis is just a very complicated word for a buildup of plaque in the arteries, which can block them or cause an embolus, like I said before, or rupture. Coronary artery disease is usually the disease which results in a patient having a heart attack, either a silent one or ischemic heart attack. The third complication we need to discuss under macrovascular is called peripheral arterial disease, or PAD. This involves the arteries leading to the lower limbs of the body. When these arteries get blocked or they have an embolus, it usually causes gangrene and even amputation for a patient who has peripheral arterial disease. So let's just summarize the macrovascular complications. We could talk about coronary artery disease or a heart attack. We could talk about stroke or a brain attack. And finally, we could talk about peripheral arterial disease or a foot attack. So are these complications serious? Yes, very much so. More than 50% of people with diabetes could probably get a heart attack. In patients over 65, more than 68% of the deaths are as a result of cardiovascular disease. Now let's talk symptoms. The symptoms of coronary artery disease involve feeling tired, swelling of the feet and the ankles, heart palpitations, as well as shortness of breath. The symptoms of a patient who has a stroke would be slurred speech, difficulty in swallowing, impaired vision, and usually one side of his body would be paralyzed, and the patient would have a numbness or tingling. Symptoms of peripheral arterial disease, which involve the lower limbs that we have said before, would be a coolness of the lower limbs. The patient would find that the hair on the lower limbs is less, and that your calves pain when you walk, and even when the feet are resting there is pain. A patient with peripheral arterial disease may develop ulcers on his legs. These ulcers sometimes do not heal promptly and may lead to gangrene forming on his legs, and may eventually lead to an amputation. It's important to look at your lifestyle. Lifestyle is actually the first basic when you start treating somebody with diabetes. Lifestyle involves making healthy eating choices. It involves keeping a healthy weight, looking at your waist circumference, and of course not smoking. Cutting out fats in your diet is a good option because it helps with the cholesterol. Regular exercise is an absolute must. It's always important to work with your health team. And remember, diabetes management is a teamwork effort. It is important to see an expert physician at least once a year, and this physician will do kidney function tests for you, and he will most probably do an ECG to check if your heart is functioning correctly. An ophthalmologist will check your eyes to see that you have no damage in your eyes. What you can do every day is check your blood glucose. Check your blood pressure at home. My final message to you as a person with diabetes is always remember, don't be despondent. There is help out there. Complications can be prevented. We just need to work together. We need to stop diabetes. If you are discouraged, remember, we take one step at a time. And always remember, the longest journey always started with the first step. Take that step.